my task for today, it's not so easy, is to present some epidemiological data in South America. As you know, we don't have so many data. I will present, as you probably know, for sure you know, the T-cell project chaired by Massimo Federico. It's an international registry that includes, for the first time, South America, and I would like to thank Massimo to agree to this presentation of the centers in South America of the T-cell project. This is the T-cell project that you all know. The objective and the endpoints is to get a prospective collection of data, probably to better define the prognosis of the most frequent peripheral T-cell lymphoma, the NOS and AITL, and to improve the knowledge, the clinical and biological characteristics and the outcome of the less frequent subtypes. And the primary endpoint is 5 years overall survival. In this slide, you can see we have now 1,308 cases recruited by 73 centers. And you can see here most of these centers belong to Europe, 46%, 20% from the US, 20% also from South America, with 7 centers, 3 in Argentina, 2 in Brazil, 1 in Chile, and 1 in Uruguay, and 14% in the Middle and Far East. These are the general data, the general characteristics of the patients. And you can see in the left in red the age, the gender, the ECOG performance status, the B symptoms, other disease-related symptoms, and the stage. You can see that the patients 6 or more years old, we have 35%, male 57%, ECOG more than 1, 44%, B symptoms in 60%, and advanced stage in 58%. There is no important difference among the different countries. Related to the subtypes distribution, you can see in general the most frequent subtype is PTCL and OS, account for 40%, followed by anaplastic large cell ALK negative, 25%, and followed by NKT nasal or nasal type lymphoma, 11%. It's interesting to show that, in Brazil, we have less cases peripheral T-cell lymphoma and OS, 28%, and we have a high number of nasal NKT cell lymphoma, more than the other countries in South America, at least in this analysis. Related to the therapy, we have a very heterogeneous therapy. Most of the patients received chemotherapy, mainly combination chemotherapy with anthracyclines. And related to the high-dose chemotherapy, we have a lower number of patients transplanted in South America than in the rest of the world, as I will show you. Here we have almost 25% patients are transplant in other continents, and in South America, 14%. But when you separate just Brazil, Argentina, and Uruguay, we don't have difference, statistical difference between the types of therapy related to the other continents. These are the Kaplan-Meier survival curve, and you can see that patients in Brazil have a better outcome than in the other countries. And the main cause of death was lymphoma, followed by infection. Here you have a classical curve of outcomes in the different subtypes. The better curve are the ALK positive anaplastic large cell lymphoma, and the worst, the peripheral T-cell lymphoma gamma delta. Just 15% of patients are alive at 3 years. So in conclusion, PTCL is a very heterogeneous lymphoma, many subtypes. Treatment remains challenging. Retrospective and prospective data seems to be similar, and we are looking forward to new information and therapies. I would like to thank especially Monica Belay and Emanuela Pesce from Modena that helped a lot to prepare these slides. Investigators from South America, Maria Helena Cabrera, Carmen de Souza, Raul Gabus, Maria Virginia Prats, Lúcia Zopeno, Astrid Pavlovsky, and mainly Massimo Federico, that is the chair of this study. I have some comments to finalize this presentation. This is the first international epidemiological project on T-cell lymphoma that includes Latin America. The Native Americans have a great genetic similarity, despite the high linguistic and cultural diversity, to the Asian population due probably to the migration occurred across the Bering Strait on Ice Age. We are not the same. This is very important to say. When we read some papers saying in South America this happened and that happened, it's not true because we are different. Brazil, the largest country, has a very mixed population, as you know. Some countries in Latin America, like Peru and Chile, have a large segment of pure Amerindians. This ethnic, regional difference may determine different epidemiological profiles in PTCL. We have to include other countries, more centers, and more patients to do better understand PTCL in Latin America. Do that, we are starting a registry in Brazil. The coordinators, besides me, is Carmen Antônio de Souza from the Brazilian Society of Hematology and Massimo Federico from the T-cell projects. The objective of this new study is a prospective analysis of patients distributed in all 5 socio-economic regions of the country. This analysis probably will limiting the bias found in the previous studies. We will include ATL in this study that it's not included in the T-cell project. And these are the first 13 centers that you will be involved in this study. As you can see here, all the national regions are involved in this new study. Thank you so much for your attention.